Everyone heard that.
Come in.
Hi, Dr. Pitts.
Hello.
I'm Ashley Wyatt with GlaxoSmithKline. Thank you for having me today. May I have a seat?
Yeah, absolutely.
Thank you. Here's my business card.
Thank you.
If you need to get in touch with me, my phone and email's on there if you have any questions, so feel free.
Okay, great.
So, how are you doing today?
Amazing. How are you?
I'm good. Very happy today. I just want to start off by saying I really appreciate what you do here. You know, quitting smoking is something that's really personal to me. I've lost my own grandmother to lung cancer from smoking. No, it's fine. I mean, I'm sure you're a physician. We've all, you know, experienced loss.
In there.
So, and also, congrats on the recent growth that you've had with the smokeless clinic.
I know. It's unbelievable.
Yeah, a lot of changes, huh?
Yes, a lot of changes.
So, how did you get into this?
Actually, I was first a brain surgeon.
Really?
Yes, I was. And, you know, I just didn't feel like it was fulfilling enough for me.
Yeah.
So I really wanted to get into something where I was really changing lives, and I also lost somebody to smoking. So I can relate to you on that one.
Yeah, you wanted to do something on a more personal level.
Yes, and just brain surgery was, you know, wasn't doing it for me.
That's got to be so rewarding.
Yes.
So what's your relationship with your patients like?
Oh, my relationship with my patients are wonderful. You know, I really get to know them. I see a lot of them. I'm their #1 fan. And I see them, you know, quite after that they leave the program also. So that's great.
That's good. Good that they come back. And so, I mean, I know this is part-time for you, correct?
Yes.
Since this is, you know, nonprofit. What do you do when you're not here?
Sometimes I still do brain surgeries. So, you know, that takes up a lot of my time. And then when I do have, I'm here at the, you know, the clinic as much as I can be.
Yeah. Well, I also wanted to make sure, are you the sole decision maker? Are you the physician in charge that's responsible for the patient's welfare?
Yes. I do, you know, talk to my colleagues. However, I am the sole decision maker.
Okay, so possibly at a later time, maybe we could have a meeting with all the other physicians.
Yeah.
To get everybody on the same page.
They would love that.
Okay, cool. So, what I'd like to do today is ask you a few questions about the Smokeless Clinic, get to know how things work, and then I'd like to talk a bit about Nicorette, tell you how we can help you guys.
Great.
And then, if everything makes sense, we'll talk about the next steps from there. How does that sound?
Wonderful.
Good, good. So do you mind if I ask you a few questions?
Sure.
And do you mind if I take notes?
Go right ahead.
Okay. Well, I was doing some research on the program, and I read that you have a 12-step progress. Could you tell me a bit about that?
Yes, the progress that we use is an intensive individual psychological counseling. We have sessions, plus we encourage our patients' membership with the 12-step support groups, and we have a great success rate.
Okay. How many patients do you have?
Currently, right now, we're seeing about, I want to say 30 to 50 patients weekly.
30 to 50?
Yes.
Okay, weekly. And how many physicians do you have on staff?
The physicians that we have on staff are myself, Mr. Dr. Bob, and we also have another young lady who comes in here and helps out on the weekends. So there's 3 of us.
So is she a physician or a PA? Does she also have the authority to take charge of the welfare of the patients and the
Oh yeah, she's one of our nurses on staff.
Okay, okay. And so what is your success rate? I mean, I know you guys have been doing really well around here.
40% actually never start smoking ever again after leaving our clinic.
That is fantastic.
Yes.
So, although that is a very great success rate, where would you like that percentage to be?
I would love for our percentage to be at 100%.
100, of course.
I mean, that's everybody's physician's goal in a non-smoking clinic.
Yeah, exactly. Let's just get rid of cigarettes.
I know. They are horrible.
They really are.
They are
I'm not
the
a
devil.
fan. I've never been a fan.
Me either.
So, since it's nonprofit, are your grants and fundings based on your success rate here?
For the most part, yes, they are.
Okay, so it's definitely really important that we get that as high as possible.
It is, because we are a nonprofit clinic here, and as much as I hate, you know, leaning on grants and things like that, it's very important, because without them, we wouldn't be here today.
Yeah, and I mean, you've got to pay rent.
Yes,
There's definitely still things that have to be paid for. So, what would happen if this problem wasn't resolved?
For everyone to quit smoking?
Well, if you aren't able to get your percent up to, you know, 100. within the next couple of months? Are you going to see any repercussions from that?
I mean, definitely there will be repercussions.
Okay.
You know, it's just going to be harder for our patients because we're going to be losing, you know, the support that we have. And I don't want to do that to them where, you know, we have to cut back hours or we don't have the staff to be able to come around and help out. And we just lose a lot at the clinic if we don't have the support coming in from our grants and our funding.
Okay.
So it is a problem.
Yeah. Okay. Well, I think we could help you out with that. So what are you doing now besides counseling to reach that goal of 100%?
Well, we do prescribe very few drugs at the present time because I definitely prefer a non-drug approach for nicotine withdrawals.
Non-prescription drug approach?
Just any prescription-wise approach. Being a doctor, I would prefer that they would be able to assess everything based on their support and overcoming their willpower.
Okay.
However, I do prescribe, but it's just very, very small amount.
Okay. Alrighty. And what number of patients require these prescriptions?
The number of patients, it is, like I said, I have about 30 to 50 patients a week. Probably about 20% of those patients I prescribe
20%?
for. Yeah.
Okay. Let's just do the math really quick. We'll say you have 40 a week on average.
Okay.
So 8 of those patients are going to require prescriptions per week. Okay. And so does that get kind of time consuming?
Writing prescriptions?
Yeah.
Yes, it is a process.
Yes. Capital letters, yes. So why do you think the 60% are not successful, in your opinion?
Smoking, I don't know if you've ever been a smoker or not. I want to say the hardest part is when they are doing their normal lives and Dr. Pitts isn't there to hold their hand and say, no, don't smoke that cigarette. They have cravings.
Yeah.
When they're in their car or after they eat, and that's the hardest part. Or when they're out partying with their friends and they want to light up. You know, Dr. Pitts can't be everywhere. So I feel that it's mainly their cravings is what it really brings them back to not being able to be successful. And that's where that 60% falls into. Okay.
I'd like to write some of these down on a side sheet of paper just so we can keep track. So you said one of your problems is the time consumption and then the cravings. And with the cravings, would you agree that addictions are just as much physiological as they are psychological?
Yeah, I would agree with that.
You know, overcoming them. Yeah. Okay, so another thing, other clinics had mentioned to me before that they worry about the safety of the prescriptions. Is that something that's a concern for you as well?
Absolutely. The safety of my patients are number one.
Okay. So we'll write that down as well. Okay. So do you get patients to come back with success stories pretty often?
Yes.
And how does that make you feel?
I love my success stories. And I do love seeing them. They come in on a regular basis. A lot of them actually volunteer here to help out with the counseling, so it's wonderful.
Oh, good. Well, I want you to have that loving feeling more often. So what I'd like to do is touch on some issues, talk about Nicorette, and tell you how we can help you. And if I can cover all of your concerns today, is there anything that would be holding you back from moving forward?
No.
No?
Sounds great.
Okay, perfect. So let me get started. And I also brought some brochures today. You can give out to the other physicians or the patients.
Okay. Oh, these are
There's
great.
Plenty, yeah. So, a bit about our company with GlaxoSmithKline. We're the second largest pharmaceutical firm in the world. And a bit about Nicorette. It's available in different dosages, 2 milligrams and 4 milligrams. It has child-proof packaging. You definitely don't want your son or daughter going in, eating a Nicorette and thinking it's bubble gum.
Right.
So, and it's also sized for a 12-week treatment period, which could go along great with your 12-step process. It comes with instructions. It's sugarless. They don't have to worry about calories, and it comes in 4 different flavors, as you can see here: the mint, fresh mint, citrus, and original. So how it works is when you chew the Nicorette gum, a low level of nicotine is absorbed into the tissues of the cheeks, and you know that gets into the bloodstream and up to the brain, and it helps just satiate those cravings, and it keeps them at bay, and it's going to make your patients more confident that they can quit when they can get over those, you know, cravings. They can move past them, and they're going to have that confidence of, I was able to resist that cigarette, you know?
And that's what some of our problems are.
Yeah.
Yeah.
And then we also offer a find your quit method online so they can find out which milligram strength is best for them. It also says here if you smoke your first cigarette more than 30 minutes after waking up, use a 2 milligram. And if it's after 30 minutes, use the 4 milligram.
Okay.
And we also have a recommended usage that's inside of the brochure that you can hand out. It just says how many pieces they need, you know, per day, per month.
Mm-hmm.
But since you said that one of your problems was cravings, they don't necessarily have to follow the recommended regimen.
Right.
They could just take it as needed with the cravings.
Okay.
And I have a feeling they would hardly ever have to take any because your counseling goes along with it.
Right.
So that's really going to help them.
Okay.
So how's everything sounding so far?
Everything is sounding good. I mean, we are really satisfied with our present program of our psychological counseling.
Mm-hmm.
So.
Okay. So we'll touch on the concerns now. So from what you told me, it's time conception.
Like I said, with the prescribing, we really like a non-drug approach.
Yeah. Well, the great thing about Nicorette is it's over the counter.
Mm-hmm.
So I was actually going to get to that. With the time consumption,
awesome.
You don't have to write a prescription.
Okay.
You know, how long does it take you to typically write a prescription?
It takes up some of my time. The procedure is quite lengthy.
About 15 minutes?
Yeah.
Okay, so 16. So that's 2 hours a week of your time that you could get back.
Wow.
And help other patients.
2 hours?
Do you really see the benefit in that?
Yeah.
Yeah. So would you say that I've resolved your concern about time consumption?
Yes, definitely.
Okay. And since we talked about the cravings and the recommended usage and the fact that they can take it just as needed, did I resolve your concern about that as well?
Yes, I do have a question though.
Mm-hmm.
Some of my older patients, they wear dentures.
Okay.
So they might not be able to chew the gum.
Yeah.
A lot of my patients wear dentures actually,
okay.
you know.
Yeah.
So what do I do for them?
Okay, well, we also have the Nicorette skin patch. That's something that they could place on their skin, and it releases a low level of nicotine slowly over a period of time to help them wean off that craving and that addiction. So does that kind of solve your concern about that?
So there's a patch also.
Yes, there's also a patch.
Instead of the gum.
We typically recommend the gum, but the patch is also available.
Okay, and they don't put the patch in their mouth.
No,
Okay.
the patch goes on their skin.
Okay, good.
Yes, it's topical.
So that we won't have to worry about the dentures then.
Mm-hmm.
Okay.
So does that resolve your concern about that?
Yes, actually, that makes sense.
So how's everything sounding so far?
Everything is sounding good.
Good. And also about your concern for safety, I wanted to show you, we have 25 plus years of FDA support, and there's 56 safety and efficacy studies that have been performed.
Okay, great, because another thing of mine is I wanted to know about the risk. So it is FDA approved?
It is FDA approved. There's constantly studies done, each year. This is all of our FDA drug details. Even on the FDA, they recommend over-the-counter drugs versus prescription drugs. And the FDA has recently come out with evidence that shows that it doesn't matter how long they use the Nicorette, it's still safe for them.
Okay, good.
So they don't have to be concerned about that. And we also have 3 research facilities constantly doing work. So does that resolve your concern about safety?
Yeah.
Awesome. So, do you have any questions for me since we've resolved everything today, or do you feel comfortable moving forward now?
No, I feel that we've covered everything so far.
So what I'd really like to do is just get a confirmation that you'd be willing to recommend Nicorette to your patients.
Like I said before, we really just like to stick with our present program of the psychological counseling.
Mm-hmm.
However, the nicotine treatment, I'd like to agree to recommend it to one of my patients on maybe a trial basis only.
I could definitely do that for you. And you know what? I actually even brought in some samples of our 2 milligram and our 4 milligram today.
Wonderful.
So that you can give this to them. It's going to be at no cost to them. And then how about we set up a follow-up meeting next week, Tuesday at 2 p.m. How does that sound?
Okay.
Okay.
Next Tuesday at 2 p.m.?
Yep, and could I have you sign here?
Actually, I have brain surgery that day.
Okay.
Do you think that we can maybe do it maybe 2 hours afterwards?
That's fine, 4 p.m. Okay.
Perfect. Okay.
Thank you so much. It was really great meeting with you today.
Wonderful to meet you, Mrs. Wyatt.
And I'd also, after this meeting, I hope that we can come back and really form a long-term relationship so I can see how your patients progress through the process.
I would love that.
Thank you so much.
Thank you so much. Have a great day.
You too. Do you want to turn it off?